Hello, welcome to Health Authority TV. I am Dr. Janan Sarwar. I'm the deputy editor for Health Authority Books. It's an imprint and a new partnership between Indie Books International and Global Bookshelves International. On this show, we talk to health leaders, people that are doing innovative things, and today I'm very honored to introduce you to Dr. Kimberly Delbo. She's an award-winning nurse leader, healthcare transformation catalyst. She's currently an assistant professor at the Commonwealth University of Pennsylvania Briner School of Nursing, and she is the vice president of education at Power Up Nursing. She brings over 20 years of experience, or nearly 20 years of experience, reimagining care, whether it's at the bedside to boardroom settings. She's incredibly passionate about human-centered design as well as health equity. And Dr. Delbo empowers teams to create thriving, compassionate environments where patients, professionals, and everyone can flourish. We've chatted a little bit before, we've met in the past. I'm so inspired by all that you do. I know I didn't cover everything, so just thank you, first of all, for being here.
Oh, thank you, Janan. It's an honor, truly an honor to be here with you, and I'm delighted. Thank you for this
Yes,
privilege.
you are most welcome. And, as I shared just a few people, who do you say and who do you want to share with all of us that you would say you serve as a health authority leader? Who are you
Mhm.
working with?
So right now, I would say, at Power Up Nursing, my role as Vice President of Education, we serve nurses, the heartbeat of healthcare, and the organizations that employ them. So, our mission is really to advance the science and spirit of nursing, and we believe that this is a solution to the global healthcare crisis. So we help support the nurses that work in hospitals and other organizations, and even in education. And we believe that hospitals are the linchpin for equitable, sustainable community health and ultimately human flourishing. So it's really all of humanity because I'm a nurse.
Yeah.
But the fact of the matter is, it really is nurses in this role that we're aiming at, and then healthcare professionals. And why we do it is when we look at the data, it's really quite sobering. Nurses are more likely than the generalized population to be obese, smoke more, suffer from chronic sleep deprivation. Burnout is an occupational health crisis, and it's been defined as ineffectively managed workplace stress. So when the data clearly shows that there's like 56% of nurses that are experiencing burnout, and tragically every minute 1.3 nurses die
Oh
of
my goodness.
suicide. Yeah, it's just devastating. So it truly is, it's a crisis, but it's also a calling for us. It's a call to action. Even I teach, you mentioned that I teach nursing as well. And the data shows that 30% of new nurses within a year of becoming a new nurse are choosing to leave the profession, and up to 60% are leaving within 2 years. So again, this is not has major implications for sustainability,
Yes.
impacting the health of communities and healthcare organizations. And it impacts their bottom line, but most importantly, the health of all humans. So, this is a call to action, and we're here to support nurses and organizations with the tools and resources and innovations that we need to take care of ourselves, but ultimately provide better care for others, our families, our colleagues, and our communities.
Absolutely. I think that this is such a phenomenon. And, as you're saying, the mental health crisis and the way it impacts just the individual nurses one to one, as well as that further impact. And if you're seeing that students or new nurses are coming into the field and quickly exiting, that's not the sustainable future. So uh, what are your solutions? So tell me, you mentioned some, I love the word innovation, especially in this day and age. I am impressed with what I've already heard, but tell all of us in the audience, what kind of services are you doing when you're supporting this very important demographic?
Sure. So we offer a full suite of innovative services that are built around partnership and purpose and cutting edge technology. And we conduct on site assessments, evaluation, culture of organizations, and then create a Power Up roadmap plan. With our partners. We also have partners that we're working closely with, Ultra Human. They are a leading healthcare organization, and they create a roadmap plan with our partners. We also have partners that we're working closely with, Ultra Human. They are a leading healthcare organization, and they create a roadmap plan with our partners. We also have partners that we're working closely with, Ultra Human. and Moxie 360. And together we form a hospital program that helps to improve the healthcare system by integrating AI empowered resources, such as my ultra human air ring here, to help people to basically leverage technology in a meaningful way to provide that bioanalytical feedback and data to guide their health and well-being. So basically, put AI on the fingers and in the pockets of nurses and even those that are studying to be a nurse. I didn't mention this, I don't believe, but it's like 56% of nursing students are experiencing anxiety and depression.
Mhm.
So we're actually also have a program called with in collaboration with UltraHuman, the Ultra Nurse Ultra Student program that uses wearable technology and again that bioanalytical feedback to track their own health physiologically and mentally, looking at their sleep quality index, their movement, their heart rate variability, their stress levels, and then using self reflection to impact their overall health holistically. We've also partnered with an organization called Moxie Scrubs through and have the Moxie 360 app that we offer to our healthcare partners or hospital partners. And it's basically a white label app that's born out of the Harvard Innovation Lab. And we pair that, it could be paired with, yeah, the ultra human air ring or used independently. But this app, it provides nurses with a ton of data, resources out the wazoo. It's kind of crazy. Wellness resources, CE, educational content, access to their facility policies, just basically in a moment by just saying show me the facilities policy on insertion of Foley catheter and boom it pops right up, which saves nurses a ton of time, and ultimately gives them the resources at their um, at their fingertips again, right
Yeah.
there. And it also integrates a mentorship program, which is so essential for helping that longevity and career sustainability for nurses. Everything is backed by data because we believe that really what gets measured matters. So it's driven by the real world needs we have today in nursing and in healthcare, and designed to restore and uplift nurses and the healthcare workforce at large.
Absolutely. Why do you think we haven't really considered this before? I think, the
Mm,
traditional nursing model or when we're studying, being a
mm,
past student, maybe even thinking back to your experience back in school, it has always been so much patient driven. But you were sharing with me the importance of if we
mm.
do look at that health leader, that nurse that's and really look at their burnout and their stress, maybe you're really changing the tides to helping us focus on that individual. Tell me about, are you seeing this happen in other fields, or tell me about the changes that you're seeing related to
Ah,
this?
yeah, well, even I think, you look at information. Information now doubles every 12 to 18 hours, which is kind of crazy when we think about it.
Yeah.
And this can have major positive implications for us if we use it appropriately. In addressing the system of healthcare specifically, and in
Yes.
even education, right? Because it kind of spans the sectors of healthcare and education. Healthcare has traditionally been operated underneath that medical paradigm,
Yes.
where it's a sick care model, right? Being a pharmacist in the past, and that sick care model where it's highly reactive and kind of addressing things after the fact, after people
Yes.
are already sick.
Yes.
Whereas nursing has been historically founded. Our roots are underneath a holistic health paradigm.
Yes.
So looking at that paradigm and leveraging it to change the everything to be more proactive is really where
Yes.
we're going. And then addressing in the process the medical error. Medical error is the third leading cause of death in the US. So this fundamental shift, I believe, is really going to change all of that once we truly embrace it. We know that most health 80% of our health is defined outside of beyond the walls of our hospitals, right?
Yes.
It's defined where we live, learn, work, play, and play, in our homes, in our jobs, in our schools, our communities. And that's why we focus on advancing that quadruple aim. Those four things: quadruple aim, improving the patient outcomes, reducing the cost of healthcare, because again, going back to how much we spend on healthcare and our outcomes just aren't showing that it works. And then enhancing the patient experience while also improving health worker well-being and restoring joy to practice for healthcare professionals. So this, I believe, our program and the Power Up Nursing and even the grassroots movement of this organization is really aimed at empowering nurses as leaders and the change agents that they are, while addressing the social determinants of health and leveraging that data and the information that we have now available at our fingertips, to get the resources to where they need to go while addressing four pillars of health.
Yes.
And the four pillars of health that we look at are employee health. And if you think every organization in America or in the world, for that matter, right, embraced these four pillars of health of I guess holistically, physically, mentally, emotionally, socially, and spiritually, but also looked at addressing employee health, consumer health, community health, environmental health.
Yeah.
We truly can do what healthcare was always meant to do, and that's to bring health and hope and healing to all of
Yes.
humanity. So I really think that this is the time for change now, more than ever, with artificial intelligence, machine learning from a positive standpoint, all that it can bring to us. When we think about changing the health of our communities and making health better and easier for everyone.
That is incredible. I loved what you said specifically, just bring what our healthcare system is meant to do and, back into the power and hands of those that have an impact. And, you did address this in many ways, but I'd love if you could summarize what you could dream of if you had a magic wand to be able to redesign the healthcare system to be an ideal system.
Wow.
What would it look like? What would change?
Um, the focus would be on neighborhoods, um,
Okay.
and shifting care out into the neighborhood by looking at a human flourishing model,
Yes.
looking at health from that physical, mental, emotional, social, and spiritual component, and then taking it in all aspects across the system. Looking at workplaces, because a lot of the time that we spend, most of our waking hours is at our work. So,
Yes.
workplace well-being solutions, looking at these four pillars of health: employee health, consumer health, community health, and population health, and championing those out into the communities, um, across sectors, breaking down the barriers, addressing social determinants of health, and leveraging technology, cutting edge technology and innovation, in a meaningful way to make change. And also, um, moving health beyond the walls of the health system,
Right.
and seeing it for what it really truly is out into the community. So I have a vision for nurses, even parish nurses across all different, uh, you know, regardless of religion or
Yes.
whatever it might be, to have nurses everywhere in the communities.
Yeah.
To transform, even change the health of a zip code. There's one
Yes.
organization out there. I'll give a shout out to Nurses, um, Transforming Healthcare.
Okay.
They have a flip the zip movement, to change the health of a zip code. Personally, Janan, I'll share a personal story. I live
Yeah.
in a community in central Pennsylvania where I was born and raised in Northumberland County. Um, People live on average 17 years less than a county 17 miles away. And I would love to see that changed. Not just in my community, but in other
Right.
communities across the globe. We're just one, right?
Yes.
There's so many communities out there that we need to look for equitable health solutions to address disparities. in populations, and addressing these systemically and systematically is critical.
Absolutely. Oh, wow. That is incredible. I love your vision. I love the way it can impact. And I'm so inspired to, be able to even think of, as you were sharing, like how data and our personal data and how using innovation can help us examine and understand what the triggers could be and how that impacts all those components in the healthcare system. So this is
Um,
incredible. The work that you're
Thank
doing is powerful, so
you.
powerful.
Thank you. And likewise to you. We couldn't, we're in this together. It
Yeah.
truly is going to take a village and so many people that are going to come together to make these things happen in our world. I believe that this is the time. There is a shift going on.
Yes.
Um, it's so awesome to be a part of it. It's a joy. It really is a joy.
Yes. So if people are interested, they hear about you and all the things that you're doing. I know you speak on many platforms about this. What is the best way they could reach back out to you? How do you prefer?
They can reach out to me at DrKim at powerupnursing.com, and I'd be happy to, talk with them more about what we're doing. Thank you.
Wonderful.
Yes.
Yes. Thanks for being on this program, and we'll definitely have your full bio and other information and your email address available. And again, for all those that are watching, thank you for tuning in. We'll have another guest next week. And until next time, may you all be healthy, wealthy, and wise. Thank
Hmm.
you. Thank you so
Thank you,
much.
Janan. Thank you. Have a wonderful day.